Americans have found solutions amid the COVID-19 pandemic to keep children learning, communities connected, and businesses moving forward. But we've also lost hundreds of thousands of loved ones to this tragedy. Too many Americans face crippling medical bills and long-lasting health problems. Now, more than ever, we need common-sense insurance reforms that protect consumers, cover needed care, and improve insurance quality nationwide. Even before the pandemic, more than half of Americans with insurance through their employer said they had postponed recommended treatments over the past year because of cost. These fears about healthcare costs are well justified. An estimated 2/3 of all personal bankruptcies are tied to medical costs. This issue is even worse now that 42% of Americans have lost a job or taken a pay cut because of the COVID-19 pandemic. This consumer burden of higher healthcare costs keeps growing as deductibles, out-of-pocket costs, junk insurance plans, and restrictions on the use of money-saving drug coupons increase. It's no wonder Americans are suffering. Prior authorization is when physicians are forced to get approval from insurers before patients can receive the procedures or medications they need. Instead of doctors just treating patients, this complex process often requires phone calls, filling out forms, middlemen, and even faxing documents. 9 out of 10 physicians agree that prior authorization rules negatively affect patient outcomes. One patient victimized by prior authorization was Colin Holler. Colin was diagnosed with metastatic melanoma at age 25. He needed scans every 3 months to track his progress against his aggressive cancer. But the pre-approval required for each scan sometimes delayed his test by a month. And when Colin desperately needed an immunotherapy drug, he had to wait for prior authorization yet again. He was finally approved to start the new drug he needed. 2 weeks after, he died. Compared to white Americans, communities of color are more likely to have diabetes, HIV/AIDS, asthma, obesity, and Alzheimer's. One reason is that people of color are likely to live in places with higher poverty, more pollution, substandard education, poor housing, and systemic racism. Making the problem even worse, 120 rural hospitals have closed since 2010, while many rural hospitals that serve Black communities are at high risk of closure. Most are clustered in states that chose not to expand Medicaid coverage to low-income children, seniors, and families under the ACA. Today, the average family spends $8,200 on healthcare premiums each year. That's about 20% of total household income for the median African American family. In America's healthcare system, Black women are over 3 times as likely to die from childbirth as white women. Black Americans are 5 times more likely to contract the coronavirus than white people. And health insurers still don't adequately cover mental health, substance abuse, and certain preventative medications. It's time for policymakers to implement policies that help eliminate racial disparities and all forms of discrimination in healthcare. Want to help end runaway out-of-pocket costs, harmful prior authorization rules, and healthcare discrimination? Learn more by visiting the Consumers for Quality Care website today.